Chapter 9 is all about the head and face. Injuries to the head and face occur frequently, especially in activities that have contact. Many of these injuries are severe and life-threatening because the brain and the mechanisms of injuries that we see with the head and face. In order to treat an athlete, we have to make sure that they may have a cervical spine injury, and if they do, we need to maintain inline stabilization until we can determine if they have an injury or not. If they do, we have to make sure that we respond accordingly in our primary survey to call EMS. If they do not, we can then continue on with our secondary survey and provide proper care, as we talked about in the last chapter. In this first part, we're going to look at injuries to the head. Now, there are a lot of injuries that we're going to look at. This is a very broad overview of the injuries. I'll try to add some information here and there. But when we look at injuries to the head, they can be very traumatic, or they're not as traumatic, and we can provide care. So the first one we're going to look at is mild traumatic brain injury. And this is what is referred to as the more commonly known as a concussion or cerebral concussion. And this is when the brain is jarred in the skull, which results in an altered consciousness and neurological deficits. And typically, this injury is not life-threatening. However, it can be very serious as well, and the signs and symptoms could go on for a short period of time or a long period of time. Typically, when we see this type of injury, it occurs from a direct blow to the head or by falling on the head or on the body, or a strong force to the core of the body, causing a whiplash effect to the neck and the head. When we look at this, we know that the brain inside the skull is bouncing back and forth, and the brain is damaged when it hits the skull. And the impact for this mechanism doesn't have to be that significant for a concussion to occur. And when we look at these mechanisms, we can have these types of things occur, and the injuries that could occur from this could be called coup or counter coup. A coup injury occurs when the brain injury is located at the impact site. So if we hit on the left side of our head, the left side of our brain is going to be injured. On the other hand, a counter coup injury occurs on the opposite side of the impact force, because the brain is floating in cerebrospinal fluid in the skull, that the head is going to hit possibly on the left-hand side, but then it's going to bounce back to the right and actually be injured on the right-hand side for a counter coup injury. Signs and symptoms that we typically see, there are a lot. More so when I work with athletes, or when I've worked with athletes, we see a lot of headaches. They could be nauseous. They're not getting a lot of good sleep. They have impaired mental or cognitive function, so it's hard for them to study, to read, to actually sit in class. They may be forgetful. And then we also have some gross motor deficits, such as balance and coordination problems. Less likely, we see change of emotions. This is very traumatic impact to the brain. Visual disturbances aren't as bad. Sometimes they may see stars, quote unquote, or may have some blurry vision. Unequal pupil size, if it's related to some sort of nerve injury in the brain, or inability to move the eyes at the same rate or in a specific direction. Most times, we do not see a loss of consciousness. However, that does not mean that the athlete may have a loss of consciousness. We used to say that, if they have a loss of consciousness, it is definitely a concussion, and we grade it from there on. But now we know that a concussion occurs without a loss of consciousness. When we look at treatment, we want to definitely remove the athlete immediately from activity and have them rest. And even if it is a minor concussion, we need to have them rest until everything is, quote unquote, back to normal and they're not suffering from any signs or symptoms. If it is a minor, we need to make sure that their parents or guardians know what has happened as fast as possible. And refer them to a physician as soon as possible for evaluation. In our situations in athletic training, for me, we can diagnose a concussion. They don't necessarily have to go to a physician. For most other healthcare providers, you need to refer to a physician to get them appropriately evaluated. We need to make sure that we do not let them participate until all of those symptoms and signs are gone, and then we get a written note from our physician or doctor that says that they are able to go back into practice or play with proper clearance. If you want to know more about the treatment and signs and symptoms of a concussion, you can look at the NATA, or National Athletic Trainers Association, position statement on how to manage a sport-related concussion, as this goes into great depths about how to treat a concussion. For prevention, we need to make sure that we wear properly fitted safety equipment, perform skills correctly, that we're tackling correctly, that we're not putting our head down, and then we're really adhering to instructors' directions or coaches' directions while participating in activities, so that we, as the participant, do not get hurt. Now, some people have the misnomer that helmets are used to prevent concussion. This is not the case. Helmets are solely used to prevent skull fractures. There's no literature out there that says that concussions are prevented with the use of helmets. However, it may decrease some signs or symptoms, but still the brain is floating inside the skull, and it will still be injured even if we have a helmet on or not. Second impact syndrome. This is a secondary injury from a cerebral concussion. This occurs when an athlete's brain rapidly swells, bleeds significantly, and herniates due to a second cerebral concussion. And this occurs when a concussion occurs before the signs and symptoms of an initial concussion have been decreased and back to normal. So really, the brain tissue is forced out of normal position due to brain swelling and increased skull pressure, and death can occur in this situation within as little as 2 to 5 minutes if we don't treat that patient immediately. I already told you the mechanism. This is a direct blow to the head or a fall or force to the core of the body, just like a cerebral concussion, but this occurs when an initial concussion is not fully healed or treated fully. Signs and symptoms of those are the same as the cerebral concussion treatment. If we know that they've had a previous concussion and they're showing signs of second impact syndrome, which is more life-threatening, more altered consciousness, more altered behavior, we need to immediately call 911 because it is life-threatening, and we need to monitor the athlete for shock and loss of consciousness and be prepared to institute CPR at any time. Prevention, again, wearing the proper headgear or helmets for sports, as well as not allowing the concussed athlete who has not been cleared by their physician to return to play. So this is just a look at second impact syndrome. We know that A on the top left is before impact, brain's normal. On the right hand side, B, this is initial impact. This is a coup injury, so if impacted at the front of the head. The C is the counter coup, so the back of the head is the opposite side of the brain. And then another injury, we can see that both sides of the brain can be injured if another concussion or impact has occurred before the initial one has healed. A cerebral contusion is a brain injury in which the brain is bruised, in which intracerebral bleeding occurs, and this intracerebral bleeding leaks into the brain tissue, and this tissue bleeding can be superficial or deep, and it can be an epidural or hematoma or a subdural hematoma. We'll get to those in the next couple slides, but just so you know that this is where blood is leaking into the brain area. This occurs from the same similar mechanism of injury of a concussion, but a blow to a head from an object. But most times we see that this occurs in motor vehicle crashes or falling and striking the head on the floor with a stationary object compared to something that's moving. Signs and symptoms, emotional changes. So we can have emotions that are out of ordinary, that don't match the scenario, behavioral changes, headache, dizziness. So a lot of the similar signs and symptoms of a concussion. Treatment, this is more of an emergency than a concussion, so we need to refer the athlete to the physician immediately for evaluation. And if we see that the athlete shows significant signs and symptoms of a cerebral contusion, we need to monitor their progress as close as possible. And if their status is progressively decreasing, call 911 immediately and have EMS on scene to transport to the emergency department as fast as possible. So prevention for this is wearing the protective headgear as appropriate for the activity, and make sure that they follow the same rules and are using the appropriate techniques during those specific activities. You can see in that picture, this is what cerebral contusion is. It's a contusion of the brain, and you can see those white spots in that picture. That is where the bleeding is, and that is where the contusion is on that brain. So a little bit more about brain bleeding. An epidural hematoma. An epidural hematoma occurs when an artery or vein is damaged and blood accumulates between the skull and the dura mater. This is the outermost membrane of the brain, but we see that the blood accumulates in this area very rapidly, and most of these injuries occur to younger individuals compared to adults because of the anatomical structure of the epidermis and the brain. Mechanism is a direct blow to the skull with an implement or hitting something stationary. Signs and symptoms are very similar to those of a cerebral concussion and other head injuries that we talked about before. So treatment, we need to call EMS as soon as possible and care for any life-threatening conditions while maintaining inline stabilization until EMS occurs, in case they also have a neck injury as well. Prevention, same course of action as cerebral contusions or concussions, that we really need to make sure that they're using proper techniques, proper preventative equipment, and making sure that they're wearing their seatbelts in motor vehicles in case there is a crash. A subdural hematoma is a little bit different. This is when rapid accumulation of blood occurs on the brain, not in between the space between the skull and dura mater, but actually on the brain, and the blood fills in the brain tissue very quickly and starts to compress the brain. These can be acute or chronic in nature, and when we look at acute injuries, this occurs very rapidly and causes signs and symptoms to occur immediately, and it can be life-threatening. Chronic subdural hematomas may not be life-threatening and may not be as emergent as acute injuries, and this is when the blood fills the brain much slower over a longer period of time. Treatment, we need to summon EMS in either situation, specifically for acute, and we need to maintain inline stabilization and monitor the athlete to see if they are progressively decreasing in their signs and symptoms. Now, if we know that we see that they're progressively declining, we need to be ready to provide CPR and emergency care as soon as possible. Prevention, we need to make sure that they take precautions to avoid sustaining any type of brain injuries again or head injuries for this situation. This is a picture. It's a really great picture of where the bleeding occurs. First, we talked about the epidural hematoma, and you can see where the dura mater is, and then the top of the skull. And this is where we may have a skull fracture, and blood is let in via the fracture site and bleeds in the area. The subdural hematoma is actually bleeding onto the brain within that last space in the subarachnoid space, which is really right next to the brain tissue. Now let's move on to skull fractures. There's a lot of types of skull fractures that we may see, not very frequent in athletics because we have proper protective equipment, but still may occur. And we have these four that we can see, and there's some on the picture and on the screen, but A simple fracture is a break in the skull without any damage to the skin or underlying fractures. A linear fracture is classified as a break in a line-type fashion without any damage to the underlying structures, where the bone does not splinter and is not otherwise really deformed. A depressed fracture is classified by a crushing of the bone. And lastly, we have a compound fracture when the skull bones break through the skin and cause external bleeding as well. So not only do we have bleeding to take care of, but also the skull fracture as well. So we'll look at mechanisms, usually caused by a significant blow to the head. Signs and symptoms are very similar to other head injuries that we've talked about before. However, we do get specific signs and symptoms that if these occur, we should think of skull fractures immediately. First and foremost, if we have that compound fracture, we may see external head bleeding. In addition, we may see battle sign and raccoon eyes, and these occur behind the ear for battle sign and underneath or around the eyes for raccoon eyes. And this is where a fluid or blood is coming through the skull and showing up externally as a bruise in these body parts. So let's look at some pictures of these. On the left-hand side, you can see this is battle sign behind the ear, and this is where the fracture site is behind the ear, and that fluid is coming out and causing that bruising to occur. We may also have clear fluid come out through the ear as well. On the right-hand side, we can see that this is raccoon eyes, and it really looks like a raccoon with the darkness under the eyes, but it could happen around the eyes on the outside as well. But this is fluid accumulation from the inside out that's occurring from a skull fracture. Now, we may have leakage of clear fluid in the eyes as well as the nose as well, and this clear fluid is cerebrospinal fluid actually coming from where that brain is sitting in the skull. For any skull fractures, we need to call 911 immediately, maintain inline stabilization, and check breathing to make sure that they're not going unconscious. And then prevention, same thing as before, wear proper headgear and equipment, and make sure that they're aware of their surroundings when they're competing or practicing. A little bit less severe, we see lacerations and incisions, and this is the last kind of group that we're going to talk about. And lacerations and incisions for the scalp and the head are really traumatic looking because there's a lot of blood vessels, and even a minor scrape or cut to the head or to the face can bleed a lot. So whenever there is scalp bleeding or face bleeding or head bleeding, we need to make sure that there is not an additional head injury that occurred with it, such as for a skull fracture and we see a compound fracture. Bleeding does occur, but we need to make sure that there's nothing underlying, and it's not just the blood that's occurring. Signs and symptoms, other than bleeding, there may be an object protruding, and other signs and symptoms, headache, nausea, dizziness, that we see in typical head injuries may exist as well. For treatment, we need to make sure that we need to immediately control for bleeding, stop the bleeding with proper protective equipment, and provide immediate care as per the other severe head injuries. And prevention is very similar to all the other head injuries that we talked about already. What we will not talk about in this lecture are migraines, but you should still read over and review the information discussed in the textbook.